Hi, I'm Dr. Mike Milligan. I'm here with Janet Press. Janet, thank you so much for being with us.
Hi, Mike. Great to be here. It's so good to see you, and thank you for the invitation to invite me to sit down and talk with you.
Wonderful. Janet's on the cutting edge of everything. She's brought lasers, dental hygiene consultant with LVI. She's been on the cutting edge of everything, and she is again. And it's with Save a Tooth, and really it's about preserving the potential health for your children or your grandchildren for
their future, Mike.
Absolutely.
It really is.
Tell us about this, Janet.
Well, I'm involved in saving your teeth, or actually deciduous teeth. Your children when they're getting ready to exfoliate a tooth.
Right.
That modern science, like we all know, continues to move on and has recently developed uses for dental stem cells and capturing these cells from baby teeth that are naturally exfoliating. So it is about storing your tooth, saving your teeth for your future health.
Absolutely, and there's so many things that they can do now with these stem cells, and the future holds even more promise for what they can do if you get a disease, if you have a problem. They can use these dental stem cells and just absolutely improve your health and regain your health.
Absolutely.
Tell us about that.
You know, one of the things that's happening is that with dental stem cells, what we want to understand is that they're what's called adult stem cells. And what that means is that they're multipotent, meaning that they're available for different uses. Now, we're already using them in human trials for alveolar bone attachment. We're also using them in human trials for diabetes type 1.
Right.
In the last 2 months, in the last 2 months, they've been able to take the dental stem cells that have been captured from deciduous teeth and grow islets and to put these cells into the pancreas, and their clinical trials with humans are actually showing that the increase in insulin from these new functioning cells is producing the insulin to get the child out of the classification of diabetes. So,
and diabetes is on the increase and all,
Absolutely.
and we've got a way here that we can really stem that with these stem cells.
That's right. Dentistry has always prided itself, Mike, on the fact that we are the ultimate preventers.
Absolutely.
That's
yes.
what our model has been forever. And so when you look at the potential for dental stem cells, I think of it as the ultimate prevention.
I
agree.
agree.
And you know what I mean by that is that the ability to save your child's dental stem cells for the future, for, like you said, degenerative diseases. And with these cells that you can use them potentially in the future, the near future, we're able to use them not only for periodontics, but also for the use like in diabetes type 1, but also the potential for the use in the cornea, neurologic regeneration for patients that are suffering from pain. And as the population ages, degenerative diseases create a lot of pain. So the potential is endless. It's quite exciting.
Absolutely, and it's on the near horizon, many of these things, and then the future is just endless.
Exactly.
So the procedure would be just before the tooth is ready to exfoliate.
Exactly.
When it's not flip it with your tongue loose, but a little loose.
Yes.
Then the dentist takes that tooth out, puts it in a container.
Yes, actually, Mike, it's an FDA-approved medical device. It's called Save a Tooth, and a lot of us are familiar with that already because if your child's doing soccer or playing baseball and they happen to have a tooth that gets knocked out on the rough playing field, the coaches typically have this Save a Tooth container that's approved by the FDA for transport of dental materials or dental biology.
Okay. So, and then what happens?
And then what happens is that we would take this preserved tooth and ship it to a laboratory that specializes in cryonic preservation. And what that means is that through
Not chronic, cryonic.
Cryonic, exactly, thank you. And there is a company that's called Storatooth, and I'm bringing that up because, you know, when we're looking in terms of having viability and storing teeth for our future, we need to make sure that the process by us exfoliating the tooth at the dental office and then putting it into the container and sending it to the laboratory, that the laboratory takes this additional step in checking the actual tooth for viability or cell viability, so that the parent is confident that the actual stem cells have been proven to be worthy of storing.
They're viable. Worthy of storing before we go to the process of storing.
Exactly.
Okay, and then they're stored there as for the person's life.
Absolutely.
And these stem cells, they can be used for that person what's the possibility in the future that they might be used for a relative with a similar blood makeup?
That's a really great question and a really great point. That's actually in conversation, and the scientists, of course, are working with that concept and that idea.
Yeah.
And so what's happening is that we do see that there is a potential for that, a crossover. And
Right.
so, you know, there isn't any of us, whether we're an aunt, an uncle, whether we're a grandparent, whether we're a parent,
Right.
a sister, that this is an opportunity for us to be able to work with our entire family and for everybody's future, for sure.
Absolutely. In fact, I'm already going to do this for my grandkids. I mean,
Sounds
just in
great.
visiting with Janet here about
Yeah.
this, I'm signed up. I'm ready to go. We're in on this.
Good for you. I looked at it with my nephew's children as my gift to them
You bet.
and in our family legacy.
For their future
Mhm.
health.
Absolutely.
It's just probably one of the very best ways to ensure the future health, especially if they end up with some chronic problems, health problems, to be able to treat that
Right.
and bring them back to good health.
Absolutely. And you know, the company that does this is called Storatooth. And you know, I've done my research, I've done my homework,
Oh, you
and
do. Janet always does her research and her homework. Absolutely.
Thanks,
Well,
Mike.
you're one of the top speakers in dentistry.
Thank
but go
you.
ahead.
But I've done that homework because I want to make sure that all of us in dentistry go grab this as an opportunity. I look at it as a campaign for dentistry
Right.
in the ultimate prevention and giving our patients the opportunity to do something like this, and that we're at the forefront as the dental professionals in the dental office
Absolutely.
to talk to our patients about the wonderful opportunity that they have for their families. So what an opportunity. And the parents or the grandparents, the family, has an opportunity to make the decision about this because we
Right.
do exfoliate 20 teeth.
Absolutely.
And so
we need one good one.
they only need one. And
Yeah.
it's just a matter of making the decision that this is what you want to do
Right.
for storing for your future. So
Now, is there any last things you'd like to say, Janet, before we close this? Very important information here.
well, I think that what's most important is that we have this opportunity as dental professionals to make an impact way beyond what we actually do in the dental office, in giving our patients an opportunity to really save for their future and save for their health. We know that we have degenerative diseases. We know that accidents happen. If you think about the ability to grow skin in a burn victim, or to be able to replace the cornea, or
Right.
to be able to, like I said, use these cells for neurologic repair for degenerative diseases.
Right.
There's so many different opportunities that go beyond what we're already doing on
Right.
clinical trials, like I said,
This time.
with the mouth. So it's reaching out as a dental professional, and I take this as an opportunity for all of us to really become and show the public who we are, that we're all about our families and our love of our families' healthy lives.
Now, how do we get in touch with you so we can provide this service in our office, Janet?
Well, the company is www.storatooth.com,
Okay.
and so that's where I would suggest that you start
Great.
in getting in touch with this company so that you can find this out. And of course, as your dental provider, you should go to your dental office and ask your dentist and your hygienist if they're knowledgeable about this and that you're interested, so that if they don't know about it or they're not doing it through their office yet, they will because you're asking them. So
Right.
that would be my best advice.
Right. Okay. Well, Janet, thanks so much for being with us here.
Thanks, Mike. It's been a pleasure, and let's save for our future and our families. It's great.
Absolutely.